Good evening, everyone. Greetings for the day. I'm Sanyukta from All About Skin Wellbeing, and I'm sure all of you must be keeping good health. We all know taking good care of our skin is important for more than just our appearance. As the largest organ, our skin becomes the most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infections or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal infections can look like a rash and it can be really itchy and annoying. So let's connect today with our skin expert, Dr. Ravsharan Singh, live from Patiala, to enlighten us on the topic of fungal infection. Dr. Ravsharan Singh is cosmetologist and MD physician. Today, Dr. Ravsharan Singh will share with us on fungal infection. A very warm welcome to you, Dr. Ravsharan Singh.
Very good afternoon to you.
Hope you are doing good, doctor.
Thank you. Yeah, I'm fine. Thank you for having me on the show.
It's a pleasure to have you with us, doctor. And today we are talking about a very important topic because fungal infection is quite common. And I think the biggest mistake we as laymen do is to, self-medicate or try to ignore the symptoms, etc. So we'll discuss everything with you, but we'll start with what is fungal infection, doctor?
Okay. So fungal infection is caused by a pathogen that is already coexisting in the environment, but the infection happens when it crosses its limit, like the amount of fungal, it increases. It is caused by yeast, mold, and dermatophytes. They are everywhere in our environment, but when they enter our body or when they enter our skin through the cracks and holes and through the minor openings, and then they start to tend to grow inside the skin and they cause fungal infections on it. It is mainly caused by dermatophytes that are being transmitted from even person to person or from the environment, like from you can say in the humid areas, the fungus grows a lot, and the transfer from patient to patient or from people to people, it transfers a lot. So the fungus is present in our body at in a certain amount. It doesn't trouble us, but it starts to grow, and then the infectious cycle starts. And the fungus, to enter the body, it has to be some roots. Mainly it is the infected clothes, mainly it is the infected people in touch. It spreads through touch. So and once it enters, it can enter our skin layers, and even we have seen, if we talk about the systems, like it can enter the lungs. The other organs of the body can also be infected by fungus. But today, as we are talking only about skin, so we will be talking about dermatophytes that are affecting skin mainly. So that can be yeast, mold, dermatophytes, like trichophyton is there, that it's kind of fungus that affects the skin, hair, and nails. And then, so there are different varieties of dermatophytes that affects our skin and hair.
Right. So the thing is that fungus, and as you said, fungal infection is quite common. And today, as we are going to talk about the external, or the fungal infection that we normally get on our skin or scalp or nails, etc., we'll talk about it.
Yeah, fungal infection, as it is being, it's also called mycosis.
Mm-hmm.
So fungal infection can be, it's more common these days in the humid areas, and as the summer is approaching, the humidity, the weather is becoming more towards the humid side. So in the humid areas, in the summer season, we get lots and lots of skin fungal infections. And right now the season is there where fungus is ready to attack, and it has got a very good environment to grow.
Right. Right, rightly said, doctor. And that is the whole purpose of having this session, so that we can make people aware about what fungal infection is and how to tackle it. And because, as you said, fungal infection is just not affecting the person who's having it, it can also spread from him to others. So it's equally important to take care or limit it or treat it right there. Now, the thing is, doctor, almost all kinds of infections, especially skin infections, rashes, etc., they itch a lot. They are mostly they are red in colors, or rashes, etc., comes up. Now, how to identify that whatever is happening on my skin is fungal infection? As a layman, how will I understand it?
Look, fungal infection mainly affects the folds. It starts from the folds, it starts from the sweaty areas.
Mhm.
You can't diagnose it like that without being like without understanding the lesion shape and size and texture. But still, the main locations that you should be careful and you should be thinking that you are having a fungal infection is like the folds of the body. There uh, where we sweat a lot, where it is moist, the areas of the groin region of our underarms, and there the fungus tends to grow very quickly. And even on the scalp, we have a different type of fungus affecting the scalp areas also. So for the body, mainly if you want to identify as a layman, so as we say ringworm, why it is called ring? Because it's the shape of a ring,
Okay.
right? So it's not actually a worm, it's actually fungus.
Hmm.
So, but it's called ringworm. So the look of a coin-shaped lesions on the body, mostly they can be fungal, but not only. There are many skin diseases that are also coin-shaped and they don't have any fungal component in it. But for layman, if it is on the groin area or if it's on the in the folds, it's usually fungal infection. But still, you need to get diagnosed, and you should not take any antifungal self medications. You should first get diagnosed for yourself and then start the antifungal treatment.
Right. I was about to come on that, doctor, that what happens, when we normally get fungal infection, especially in groins or private parts, we, hesitate in discussing it with anyone else or taking it up to a doctor. So what we normally do, will go over the counter medication or topical creams, etc. How harmful that could be, and what should we do then?
Look, as we know that topical creams are easily available
Mhm.
over the counter in our country,
Mhm.
uh, like without prescription, they are available out in our place. So that makes it becomes difficult for the doctor to treat later on once you have already used so many drugs on the fungus, and that to having steroids in it, because mostly over the counter products that are being sold by unauthorized people, they always tend to add steroid to the fungal treatment, because the steroid will only help to decrease the itching part. So the patient feels relieved as the itching subsides. So patient feels that the treatment is right, it's helping me, and I'm being treated properly because the itching has gone. But the itching has gone due to the application of a steroid, right?
Right.
The causative agent is still alive and it is flourishing because it has got steroid now, so it will flourish even more.
Well, okay.
So over-the-counter drugs always makes the fungus more stubborn, more
Mhm.
stronger as they got the dose of their steroid. So now they are happy and they are growing well. So in the starting, you might feel okay, like my itch has gone, I'm being treated, I'm feeling better. But later on you will realize that you have aggravated your fungal infection, you have increased the amount of damage that was being done by the fungal infection earlier, and now it has increased manifold.
Right. And true, because initially these steroid creams, etc., creams containing steroids, they work like magic. And we feel that, yeah, this is what we were looking for. And see, the treatment was so easy. It was in our hands only. But later on, when it becomes really difficult or gets out of control, we realize that we should have gone to the doctor at the very first go. Another thing is, doctor, a question which is related to this only. There are many advertisements of, again, creams, topical creams, etc., on television, and which we are, watching for years, that they, work again wonder in case of fungal infection. Are they equally dangerous?
Absolutely. The what we get, those the combination of creams like 4 in 1, 5 in 1, 6 in 1, 3 in 1, it is being promoted online. But right now, IDVL and everybody is trying to restrict this kind of advertisements, and it has
Mhm.
reduced to a certain extent. But still, I will not say it has stopped. It is being still advertised, and these advertised drugs without the prescription of the doctor or without the proper diagnosis is very, very risky and not advisable to be taken by the patient until and unless it is being diagnosed that it is inflammatory fungus, because fungal infection can be inflammatory tinea also. So if it has got inflammation in it, you might need a mild steroid along with the antifungal agent in the starting. Mild, you may need it, but
Mhm.
it has to be diagnosed, like the inflammatory content is there, how much, do you really need the steroid in the starting for your benefit or not? But none of these creams that are being sold in advertisement are single salt creams or a single molecule creams. It's always a multi-molecule combination that has a steroid in it, and I don't think it should be supported or should be bought.
Fair enough. And doctor, we always say, especially in medical sector, that prevention is always better than cure.
Yeah.
Anyway, we can prevent fungal infection.
Hygiene. Keep yourself clean. Keep all the sweaty parts clean. Use a good antifungal soap in summers.
Mhm.
Take bath twice a day in summers. Keep your bed covers, your bed sheets clean. Change your undergarments regularly. And if you sweat a lot, try to change them twice a day. And keep yourself hygienically clean and avoid taking lots of sweets.
Okay, it also works. I mean,
Yeah,
more sweet.
yeah,
Okay.
definitely. Yeah. Lots of sweets, or I should say, lots of sugars. Like we see fungal infections are quite common in diabetic patients. Why?
Okay,
Because the sugar level in the blood is high and the fungus feeds on that sugar.
I see.
So sugar should be avoided and hygiene should be maintained.
Right. And when a person finally, have it, what he or she should do to tackle it?
Once you already know that you have got an infection, right?
Hmm,
So first step is go visit a dermatologist.
hmm,
Go see your doctor. It should be step one in your mind, and don't need to try and visit a nearby pharmacist and just take an anti-itch cream.
hmm.
There are so many of them. No, first get diagnosed, then take a proper treatment. Because right now the fungus is becoming so much resistant to all other treatments that are being available, that sometimes we are not able to give the patient comfort for without using a high level antifungal drug that wouldn't have been required if the first level or the basic drugs were given in the starting, and the fungus could have been controlled with the basic treatment. But as they have used high potent steroids and high antifungal drugs, we need to give them a high higher level or a more complicated molecule.
Right. So it's always important to go and consult a qualified doctor, qualified dermatologist at the very first place. It's really important. And again, as we are continuously saying, it's just not, harmful for you, but also for your near and dear ones, because it is contagious, it can spread. Now, doctor, I will also like to talk about scalp fungal infections or nail fungal infections. So, would you like to shed some more light on these?
Scalp fungus. very common, as you say, the some people say it's dandruff,
Mhm.
right? It's being sold like it's a dandruff. So dandruff is basically a Malassezia fungi that that grows in the scalp. Sometimes it can be a dry scalp also. A dry scalp can have that dry skin, a powdery skin. Sometimes it's not fungus, but usually fungal infection is quite common, and we know it as dandruff. Sometimes we have that scaly scalp, itchy scalp, and we and it starts to ooze also sometimes. So that's called seborrheic dermatitis, or you can say tinea captitis. So these are type of fungal infection that affects the scalp. You will see those rounds formation in the scalp, white dry patches on the scalp, and
Mhm.
when you wash your hair, they become red. So it is also inflamed and has those fungal component in it, and it also leads in hair loss. Like you see patchy hair loss when you get like when the scalp fungus is left untreated, then the patchy hair loss also starts. That's reversible, but it
Mhm.
starts.
Right.
So scalp fungus should also be treated properly with a proper definite, like a prescribed shampoo, a prescribed antifungal scalp lotion to prevent its side effects or prevent its after effects. Because if the fungus will stay in the scalp, it might cause hair loss.
Right. And I'm sure you'll also agree with me on this. Whenever a person have dandruff, because again, dandruff is so common. We don't know whether it's fungal infection or something else. Normally, what we do, we'll try some home remedies. We'll put curd or we'll put a lot of oil because we normally have this notion that dandruff is due to dry scalp. So we need to put a lot of oil and leave it there on our scalp for as long as possible, or we'll go for again all the shampoos and conditioners that claims that they are anti dandruff shampoos, and they have been advertised a lot on TV or by influencers, etc. So what's your take on applying oil or applying other home remedies on our scalp, or going for these cosmetic shampoos and conditioners, doctor?
So there is a school of thought that oil helps treating dandruff and fungus. Actually, it doesn't. According to me, it doesn't. In my practice, in my experience, oil always aggravates. So whenever we see a lot of dandruff or scaly scalp, we always say to avoid oiling
Mhm.
and avoid hair oil and use antifungal serums and shampoos. Or if you want to apply oil uh, for your hair shaft, that means the hair length, then you can use the oil at that area to make it moist or make it soft. But if you have a lot of dandruff and seborrhea, the oiling should be avoided. If you are too much prone to oiling, you can oil and wash within 45 minutes of application. Don't leave it overnight, because it will again give the humid environment, a wet environment for the fungus to grow. So ultimately you will not see the dandruff because it will stick to the scalp because of the oil. But you are not removing it, you are not treating it.
Right.
So there are some serums with apple cider vinegar and all these plant-based therapies are there. They usually help, but heavy oils like coconut oil, they might aggravate for if you leave it for long on your scalp.
Okay. So we can say in a way that oil is for our hair shafts and not our scalp.
Yeah, scalp should be avoided being oiled, and it can there's some specific serums can be used that will be more beneficial to you than applying the oil on the scalp.
Mhm. And can we go for again over the counter and the dandruff shampoos and conditioner, or we need to go and consult a dermatologist for that as well?
Anti-dandruff shampoos are easily available all over the world, being by a certain brand name. I won't name the brand right now, but yes, it's available all over the world. So there are some brands that are easily available, and they usually help in antifungal. anti-dandruff treatment. So if you think it's just dandruff, mild, it's not itchy, you can take a single drug or a single molecule anti-dandruff shampoo. But if you think it's scaly, it's itchy, and there is some kind of inflammation, you should always get consulted, diagnosed, and then use the shampoo.
Okay. And doctor, what about nail fungal infections? Fungal infections on
Nail
nails.
fungus is quite common also these days. It's called onychomycosis. When the involvement of nail is there, we see thick nails, powdery nails in the front, and sometimes the colors of the nail also turn to green, blue. So as it is difficult to treat a nail fungus in a quick time. It needs at least 8 to 12 weeks of proper management, because the reservoir under the nail is quite safe for the fungus to live and grow and flourish, and the medicine won't enter too deep under the nail bed so easily, and you can't inject it under the nail bed, so the absorption is limited, so the result is also slow. So if you have got nail fungus, so be prepared to have a long term treatment to remove it, and don't stop it in between, that it's not getting resolved, it's not getting removed, I'm not getting results. You have to wait to treat nail fungus. It's not like dandruff, like you take 2 washes and you see the dandruff has diminished. So don't compare your dandruff with your onychomycosis. Onychomycosis needs time, proper management, avoidance of wet jobs, like washing clothes and utensils, using gloves while doing your wet jobs, and using a good antifungal treatment regimen like a triazole or a imidazole. Like, these are all salts, all families I'm talking about. I'm not talking about the brand names or anything. These are the family of antifungal drugs that literally works in onychomycosis.
Right. And fungal infection also have this tendency of coming back again and again. So why does these fungal infection occur again and again, doctor?
Reoccurrence can be due to, as I always said, in low immunity patients or in immunocompromised patients, there can be lots of reoccurrences. And then if you are a diabetic, again there is a high chance of reoccurrences. Uh, High intake of sugar can result in reoccurrences. Again, getting back to your unhygienic environment, again, not taking proper baths or not changing your clothes regularly, keeping the area wet, or ignoring the starting of the infection can also aggravate it. Reoccurrence usually happens from the reservoirs again. You have not washed your clothes properly, you're again using the same clothes after being treated for 6 to 8 weeks, and you are fine, and you're thinking that your fungal is gone, but again you are using your old clothes that you haven't washed properly, so that also get aggravated, and then you have already spread the fungal infection to some of your family member, and from that family member you get it back again. So it's like a blanket treatment. If you get fungus and anybody is having any sort of small or starting of the disease, they also need to be treated along with you.
Now, we have a viewer with us, Rahul Batswar, and his question is, quite relevant with what we were discussing. Can stress or a weakened immune system contribute to the development or recurrence of skin fungal infection, doctor?
I would say weakened immune system due to stress, or weakened immune system can cause reoccurrence of the fungus, and can allow fungus to grow much more quicker, and uh, to a certain level that it can cause infections. So yes, low immunity, it may lead to fungal infection. Yeah,
Right.
and stress can cause low immunity.
Okay, doctor. And for example, a person in a family is suffering from fungal infection. What should that person or the other family members do to, one is definitely to contact a doctor, a qualified dermatologist, and get it treated. But while it's getting treated, what should they do that it doesn't spread?
First of all, the towels should be separate. All the clothes of the infected person should be washed separately, not in a washing machine mixed with everybody's clothes. No,
No.
then the fill up, then it'll be easy to spread.
Mm.
Okay. Uh, the contact should be avoided direct on the infectious place, like like if it's in a couple, like if it's in so from your spouse in contact, you also can spread the infection. So you should avoid that contact also. And uh, so you have to avoid basically any type of direct or indirect contact with that person.
Right. Now, in a closed or controlled environment, we can do it, like in a family, or if we are in an office where we know that somebody is, suffering from fungal infection. But for example, I'm going to a gym. I don't know that the person who just left the machine is suffering from fungal infection in his hands or something, and I just, touch the same bars or whatever, dumbbells, etc. I also have the chance of, getting that fungal infection. What should I do? Again, because I don't know. Many times in buses and, public transports, we can have this, right, doctor?
Usually the exposed parts what we get is our hands, maybe like we touch everywhere, so we get tinea manum, that's called tinea manum. So whenever you are using a public transport, like these days we are so much introduced to the sanitizers and all. So
Mhm.
sanitizers, if you use a regular sanitizer with you, it almost avoids the spread of the fungal infection to your hands and to the contact points. So keeping yourself sanitized to the all the exposed areas which are being exposed to the external environment and the other people. And always like I usually advise people who use public transport to carry a towel with them and always wipe the seat when they sit. Even if it is clean or not clean, they should give a small wipe. And we have lots of sprays to disinfect the laptops, the seats, the mobiles, and the table and chairs. So we should carry, but it is too cumbersome and not possible for everybody to do it. So when you come back home, take a good shower with a lukewarm water, wash your hands, keep yourself hygienically clean, change your dress. Don't stay in your office clothes when you are back home. Get in your home loose clothes, remove your office stuff when you are back home. After the gym, don't wait to finish your dinner and then take bath. You should first, like if you're doing an evening gym, so you come back from the gym, you take bath, and then you plan for your evening dinner. Or if you're doing gym in the morning, don't start your breakfast without taking bath.
Right.
The contact time of the sweat and the pathogen or the infectious agent should be minimum on the skin. So how to minimize it, we have to find different ways for that.
Fair enough. Ria Shah is here asking fungal infection, are they related to geographical locations? I'm sure she is meaning the areas which are more coastal or, where the humidity levels are really high.
Yeah, so fungal infections are more common in humid areas. Humidity increases the sweating,
Mhm.
and it delivers a good environment for the fungus to grow. But even in dry areas, you tend to get scalp fungal infection, seborrheic dermatitis, and tinea captitis, because the scalp gets dry and cracked. So fungal, it grows easily over there also. But what about the body fungal infections? Usually the skin fungal infections, the in the humid area, it is more easily spreadable, and it grows more aggressively. It spreads more aggressively in the humid areas.
Right.
But there is a skin barrier also. So in dry, so if you're living in a very cold region and you have got those dry skin syndrome, and you have those white dry flaky skin, and you tend to itch. So once you itch and you remove the skin barrier, you're open to all pathogens, all bacteria, fungi, anything, right? So you
Mhm.
so whenever you see any cut and crack on your feet or your body, you should treat it that very moment. You should start using a good moisturizer and avoid scratching of the area, so that the all these pathogens shouldn't enter the skin.
Okay. Uh, Related question is from Neha Sharma. Her question is, can a skin fungal infection cause an allergic reaction or worsen my existing skin allergies?
Yes. So when you are already having a skin infection, right? When you are when you're already having underlying disease of psoriasis, like, or any immune disorders, so you are inclined to get fungal infections more easily, because you already are immunocompromised, or you already have a low immune response. And if you don't treat that barrier, the skin barrier, and you leave that flaky skin to remain there, and your psoriasis to remain there, so it can have a superficial fungal infection on top of your psoriasis lesions or other skin diseases. So if you have got underlying skin disease, you should always remember you have to treat the barrier. The barrier has to be maintained. If the barrier is being compromised, then the chances of other pathogens to infect and to enter is quite higher than in a normal skin.
Right. Faria Beg's question is, Doctor, are there any specific precautions to take when treating a skin fungal infection in sensitive areas like the groin or feet? Can we use, as you also mentioned, antifungal soaps can be used? Can we also use antifungal powders as prevention?
We can use antifungal powders, but instead of using antifungal soaps, I will advise using antifungal body washes, because the soap will remain the same. You just contacted with that soap in the morning and you just rubbed it on your fungal lesion, and you have used your antifungal treatment, and your lesion is being subsidized, it is subsiding now. And in the evening, you again use the same soap. And the so I usually say it should be a no contact or least contact. So always use body washes, antifungal. If you are on an antifungal treatment, try not using soaps. And of course, to prevent a fungal infection, you should, if you are living in a humid area or you having hyperhidrosis, that is, if you sweat a lot, you can use antifungal powders in your folds, for folds of the groin, underarm. And even if you sweat a lot in your feet, there is a very common problem, like we get the itching under the feet because of fungal infection, right? So you should always use powders inside your shoes and your socks. Try to put powder inside the socks, and then you should wear it. So it prevents that fungal infection of the athlete's foot, right? That wetty foot.
Right. Tina Bhargav is here asking, Doctor, a skin fungal infection, can it affect my nails or scalp? I mean, these fungal infection on skin getting spread to
And through
scalp,
nails, right? Yeah.
toenails, yeah.
Yeah. So if you're having a fungal infection and you itch, so you are itching with your nails, right? So again, you are letting that fungal elements or fungal filaments enter your nail bed also. So yes, if you itch your fungus, they can enter your nails also, and and harm your uh, nail bed, and it can even cause a mycosis to you, a fungal infection of the nails. So if you have got a fungal infection, it may spread to other parts of the body also. So my answer is yes.
Okay, doctor. And doctor, what are the treatment options available?
Um, First of all, they are like, the basic is topical treatment, oral treatment, and in severe cases that we don't do it in skin, there are also injectables, also antifungal, but we don't use it in skin. In dermatology, usually the topical and oral treatments are enough. So we got different groups of pharmacological products. I won't name the drugs, but there's different groups. So like we have got azole group, like we have got imidazole and triazole groups. So there are different oral treatments and topical treatments. So it depends on the location. So which drug is to be used, right? It has the trichophyton has to be recognized, like, which area the dermatophyte has to be recognized, the which area it is infecting, and which drug will work the best for that area. So keeping the area dry, washing it, keeping it dry, and then applying an antifungal drug is like a good option rather than applying an antifungal drug on the sweaty area or an uncleaned area. You should always wash with warm water, dab dry, and then apply your antifungal drug. Oral management has it varies from different pharmacological groups. Like some dosages are daily dosages, some doses are weekly dosages. So it all depends upon the diagnosis and the area that it has affected.
Right. How important, doctor, it is to complete the dosage, because what happens, will stop taking the antifungal treatment as soon as we get some relief from it. So even if the relief is before completing the dosage, how important it is to complete the dose.
That's a huge reason for reoccurrence, because you have made the fungal weak, but you have not killed it. It will grow back again. So there has to be a proper dosage management that the physician should also explain you on the day one, when he or she will diagnose you, that you should be under treatment for 8 weeks, for 6 weeks, for 12 weeks, according to the severity of the disease. So if you are being told in the starting and informed the duration of the treatment, you should finish the treatment till the end and then take on follow-up topicals like powders and body washes to prevent the reoccurrence. Even after stopping the drugs, even after stopping your medical management, the body washes and the powders should not be stopped.
Right. And doctor, because many a times pregnant women also get fungal infection, and plus with them we can't just give her anything, in oral treatment or etc. Now my question is, a, how important it is for a pregnant woman to go and consult a doctor rather than self medication. Plus, as a doctor, what's your line of treatment for a pregnant lady or a lactating lady?
There are a lot of topical drugs that are safe in the first trimester of pregnancy, and there are some oral drugs also that are safe in the second and the third trimester. So it depends upon which trimester you are having the infection. According to that, the drugs are being decided which is to be given, and the benefits outweigh the side effects. Then only we start the oral treatment. But the first line therapy should be topical with the changing the type of clothing, keeping it hygienically clean, and then using a topical treatment for the first 2 to 3 weeks. And then if the topical treatment does not respond, then we can shift to the oral management also. But that too depends upon the which trimester are you in, and can it be used or cannot. It has to be decided by a dermatologist or a gynecologist.
Okay, doctor. And doctor, before we sum up the whole session, any take-home message for our viewers?
As soon as you see any kind of fungal infection, any kind of skin infection, consult a dermatologist, take the right opinion, start your treatment, stick to the treatment till the doctor says that you can stop it. Don't stop by yourself. In the starting, you might feel relieved, but after the relapse is there, the reoccurrence chances will be more higher in the future, and the drugs that you already used may not help the next time again, as you will become resistant to it. So to prevent this resistant problems, always take a full course of treatment. Keep yourself hygienically clean. Use antifungal body washes in summer. They are good fragrance also these days, available online and cosmetologically pleasing. So use those agents if you are living in a humid area. Take low sugar. That is what I always advise my patients. So if you are Even if you are healthy and you want to prevent fungal infections, just decrease your sugar intake and keep yourself hygienically clean.
Thank you so very much, Dr. Ravsharan Singh. It was wonderful listening to you. It was a very informative session. Thank you so very much.
It was pleasure being here. Thank you.
And we really look forward for many more such sessions with you in coming times, Doctor.
Thank you. I hope so.
Viewers, thank you, Doctor. Viewers, thank you for your active participation in today's session. And for more information and updates on skin health and care, stay connected on our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day. Goodbye.